Crohn's disease is one of a group of inflammatory bowel diseases. You have colitis, ileitis, Crohn's disease, irritable bowel syndrome. They basically all have the same symptoms, except that they present in different places within the digestive tract. With Crohn's disease, you can basically have the ulcerations and the sores anywhere from the back of your throat right through to the other end. Primarily a disease that happens to the young. Usually if you don't have it by the time you're 30 or in your early 30s, chances are you're not going to get it. The symptoms for Crohn's disease are bloating, gas, diarrhea, loss of appetite, nauseousness. It's attached to the immune system, so along with the other symptoms, you are skinny all the time. You get so much scarring built up in your intestinal tract. A lot of the food goes through me without getting the goodness out of it. You also get joint aches. That comes along with it, but that's more of an immuno thing. Anybody who's got immuno problem usually ends up with some kind of arthritis-like aches in their joints. They believe it runs in families, but they've yet to find a gene linking Crohn's disease or any of the other in the family. But sometimes it'll crop up in a family where there's absolutely no problems with digestion. Personally, I think it's all the crap in the food. I think it's the red dye number 5 and the MSG and these, huge chemical names on the box you can't even pronounce. My first stint in the hospital was almost 3 months because they were having a hard time diagnosing it, so that took about a week and a half to 2 weeks on its own. And then once they had diagnosed it, the big thing is to basically give your digestive tract a complete vacation. So no water, no ice chips, no popsicles, absolutely nothing by mouth. And you were fed through a tube in your arm. And then they would slowly ease you back onto regular foods. You'll take a prescription drug. Lots of prescription drugs will work at the outset, but if you take them long enough, two things happen usually. You will start to develop the side effects, even if you were metabolizing them properly to begin with. The longer you take them, the more likely the side effects are going to crop up, and also over time, the less effective they become. So I started out pretty much just on antibiotics, just regular broad-spectrum antibiotics, as well as anti-inflammatories, so a lot of prednisone. And prednisone's a wonderful drug for the short term as a pre or post-operative. My sister-in-law was studying to become a nurse about 9 or 10 years ago. And one of the things, I was at her house one day visiting, and she had her giant tome of prescription drugs available inside of Canada. So I'm leafing through this textbook, and I'm looking up all the prescription drugs that I'd taken over the years. When I got to prednisone, along with the other things I already knew about prednisone, the moon face, the water retention, the increased appetite, was 3 things: sleeplessness, restlessness, wakefulness. But as a long-term stay on it, I had a bone density scan done last November, so just about a year ago, and I now have the bones of a 68-year-old. Now, I don't know how open-minded people are, but for the last 8 years, and I didn't do this before 8 years ago, but 8 years ago I started smoking marijuana. It stops the pain and the nausea and the spasming going on in my colon in its tracks. What I smoke, I don't smoke and drive, I don't smoke and work, but if I say have a very painful day where I don't have to work that day, what I smoke in a day, even on a hard day like that, wouldn't even roll up into one marijuana cigarette. In the 8 years since I've been smoking marijuana, I've had no prescription drugs whatsoever. I've had no hospitalizations whatsoever. I'm not foolish. Marijuana is not a cure-all. If all of a sudden the weight starts dropping off and I'm running and living on the toilet again, I will immediately go back to the doctor and get back on the prednisone. But that's hardcore as far as I'm concerned. That plus dietary control. Oh, you're talking anything with a skin: grapes, peas, lentils, whole nuts, whole grains, whole wheat, anything that is roughage irritates. It's not that it's not good for you, but it definitely irritates, wherever you have your ulcerations happening. So if I stick to a little bit of marijuana here and there, switch over to the hardcore script drugs when I need to, and just try and keep an eye on my diet. Like, I don't stick strictly to it, but I just try to moderate it, you know. I can have corn on the cob on a nice barbecue in the summertime, but just don't have it 2 nights in a row. It's a very livable disease. It's a lot of worse things to have out there.